WFM 91.7.
A beautiful morning to you. Thank you so much for staying with us right here on Women Radio WFM 91.7. I hope your day is going on as amazing as it should. And I hope you're feeling good today. You're feeling healthy. You're not feeling one kind of headache because of stress. You're not feeling one kind of, which kind of pain with this one at the feet somewhere, because we always here talking about how you can probably try to relieve yourself of some stress, especially from work, right here on Radio Doctor. So there's some days that we get to talk about all of this, but when you keep following us, you will definitely get to hear more on how to take care of yourself. But today is not on general health anyway. Today is on women's health on Radio Doctor. So with that, I welcome you to the program Radio Doctor right here on Women Radio WFM 91.7. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio. All right, and on Women Radio WFM 91.7, Radio Doctor comes to you 10 a.m. Mondays through Fridays. All right, so today is for the Women's Health Specialty, and of course, today is supported by the Axe Foundation. All right, so yes, like I said, today's Women's Health on Radio Doctor is supported by the Act Foundation. All right, my name is Rose Yusuf Kaiser, and on Radio Doctor today I have Dr. Edopolo Osazua, a consultant obstetrician and gynecologist at St. Ives Family Hospital. Good morning, Dr. Osazua. Thank you for joining us this morning.
Good morning, Rose. Can you hear me clearly?
Yes, I can hear you clearly, Dr. Osazua.
Okay, loud and clear. Okay.
Yes.
Yes.
All right. So, how's work been? How has different patients, dealing with different patients been so far, especially as a gynecologist?
It has been fine. I would say it has been very fine because as a father that is married to a woman, so I know how to handle my women, and also a father of 3 daughters.
Oh wow!
So I'm privileged enough to know women very well, both at work and at home. So I deal with women. So far so good. Our patients are fine, and they have been having a nice time with me. They come around by the special grace of God with different series of issues, both emotional, psychological, even sometimes they also go at the level of financial and issues of infertility. They go home rejoicing, and they are all singing and leaping, just as that man at the beautiful gate did that time. So they are very happy. So I'm having a very nice time with my patients, and we are all happy.
All right, that's great to hear.
Irrespective of the stress of the country, but we will survive.
We will survive it, so doctors as well will survive it. Yes, we will. Thank you so much, Dr. Sazua, for doing the good work you're doing and for always being there for your patients, especially as they are women. Thank you for always listening, because that's just it. All right, so that is Dr. Sazua, and of course he is joining us this morning on Radio Doctor, your free health consultation program where real doctors advise real people. All right, so today on Radio Doctor, doctors as well will be consulting and advising on the prevention and treatment of sexually transmitted infections in women. So 2 weeks ago, Dr. Zozua was here. He was talking to us about STIs, the risk of STIs, and how this can affect women. So today, Dr. Zozua is going a little bit deeper, and he's looking at consulting, he's looking at treatment, prevention and treatment of sexually transmitted infections in women. All right, so that's what we'll be doing today. So let's not forget that Women's Health on Radio Doctor is supported by Act Foundation. All right, so we get to open up the phone lines, and the number to call is 07000 917 917. You can send a text or a WhatsApp message to 070 317 56537. Go ahead and of course go to our website www.wfm917.com. Download our mobile app WFM917. Listen to us from any part of the world, and of course our social media handles are there: Facebook, Instagram, X, and of course YouTube at WFM917. We're everywhere with you. Anywhere you want to carry us to, we go follow you. They go. And so we did for Women Radio. Okay, so let's head on to today's topic, prevention and treatment of sexually transmitted infections in women. And Dr. Sazua is with us this morning. So, Dr. Sazua,
Okay. Thank you very much.
2 weeks ago, we talked about the risk of STIs, how it affects women, and all of that. So today we're looking at prevention and treatment of sexually transmitted. Yes. So why is it? Okay, go ahead. Go ahead. No,
thank you very much for having me. I'm very glad to be here discussing this topic. So in the next 1 month, we'll be discussing sexually transmitted diseases.
Okay.
Last week we talked about the complications of sexually transmitted disease. Today we're talking about the prevention as well as the treatment of sexually transmitted disease. Then hopefully next week we will now take each of the sexually transmitted disease one after the other, the chlamydia, the gonorrhea, syphilis, and how we are going to manage them and what we need to do when we have this kind of diseases. But why is it important that we must prevent sexually transmitted disease? Because realize that I said last week that sexually transmitted disease are diseases that are transmitted via sexual intercourse, diseases that are transferred during sexual intercourse. And sexual intercourse can be in any form. It can be in form of vaginal penetration, oral sex, or anal sex. So any sexual infection, any infection that got through that route are called sexually transmitted disease. Let me also say that sexually transmitted disease can also be transmitted to the baby during the course of delivering, during pregnancy, during the course of delivering, and during breastfeeding. So we must know that. Why is it that it's important for us to prevent sexually transmitted disease? Let me give some little statistics that more than 1 million sexually transmitted infections are acquired every day worldwide.
Wow.
That is to say that 1 million people all over the world tend to acquire one form of sexual disease every day. And most of these symptoms are usually without any symptoms, so they are asymptomatic. 2, each year, there are estimated 324 million new infections with 1 of 4 curable STIs. Among them are the chlamydia, gonorrhea, syphilis, and trichomoniasis. These are what we are going to be discussing. Number 4, more than 500 million people, especially within the reproductive age group, that now give us a lot of concern, between the age of 15 and 49 years old, are estimated to have one form of genital tract infections or the other. Number 5, almost 1 million pregnant women who are also pregnant, are estimated to be infected with syphilis, as was stated in 2016, resulting in over 350,000 adverse birth outcome. Now, can I say that STI have a direct impact on the sexual and reproductive health through stigmatization, infertility, cancers and pregnancy, complications, and increased HIV. So we need to prevent it, because when we realize the impact of sexually transmitted disease on the health of an individual, it becomes a major issue. And lastly, more than 3 different bacteria and viruses are found to cause sexually transmitted diseases. Now, why do we have to prevent STIs? It's important for us to prevent STI because even there are newer ones that are coming up now that we know, apart from the conventional bacteria like the syphilis, the gonorrhea, chlamydia, and trichomoniasis, there are others that are also incurable, which we don't know. Okay. Because if we don't know it, it becomes the hepatitis B are not curable, the herpes simplex virus are not curable, and the HIV and the human papillomavirus are usually not curable. But there are newer ones like the monkeypox, Shigella, they are also Neisseria meningitis, they are all there. The hepatitis, herpes virus infection, the primary cause sometimes have been found to also cause some cancers. Human papillomavirus can cause cancer of the cervix as well as cancer of the rectum. And also men have also been found to also have cancer of the rectum from anal sex, as well as because of infection with human papilloma virus. So I said we talked about the complication the other time. So now how are we going to make sure we prevent these diseases? One of the major things we have to start is by education. Education. When you educate a child, they say you have educated a nation. So education is very key. So what are the create awareness of what we call safe sex practice? You create awareness for safe sex practice. One of them, and the awareness is that in what you educate our adolescent girls against the risk and likely complication that may arise from having sexually transmitted diseases. Now, one of the things we must do is that sometimes we have also encouraged these women, if you must have sex with high-risk partners, one of the things you must do, you must ensure that you put on, you wear condom. Though it is clear that condom actually doesn't prevent the ulcerative type of STIs, but they have been found to be very useful in preventing this disease. Another thing that we have to tell patients is that when you notice any symptoms, because I said initially that you have to ensure that you see your doctor for any form of, so that they can counsel you and also treat you accordingly. Now, so one of the things we tell patients is that avoid sexual activity if there is possibility of infection. Avoid sexual activity, whether with your husband or whether with your couple or whether with your friend, if there is a possibility of infection. For instance, there are patients that will refer to a high risk, i.e., people who has multiple sexual partners. They are high risk patients, sexual workers, so we try as much as possible to avoid those sexual contact with those kind of people. Now, we talk about the use of a barrier method of protection, such as the use of condom during vaginal or any form of intercourse. Now, for people who also engage in oral sex, but people who engage in oral sex, we say, when you are doing oral sex, use what we call dental dam to prevent you from having infections, and these infections can lead to cancer. Now, this one is very important. Only having sexual activity with mutually monogamous partner. So I'll say it again. Mutually monogamous partner. That is that, it's your wife, it's your girlfriend that you only have sex. Not having multiple sexual partner, because most of the time, either the woman goes out to bring the infection home, or the man goes out to bring the infection home. And that becomes an issue to the entire family with a long-time complication. 2, also ensure that, you undergo sexually transmitted disease test all the time, especially when you think you have been exposed. It's usually better when there is an exposure to a high-risk patient, but people who cannot stay in one place, ensure you do your test at each interval. So also, we have also found out that, sometimes vaccinations are also been found to be useful in preventing sexually transmitted diseases. So the human papillomavirus vaccine will be available, which is available at the Severance and the Gardasil. We also have the hepatitis B infection vaccine that will also be found to be very useful in preventing hepatitis, which is a form of sexually transmitted disease. So we also encourage people who are also indulge in alcoholic activity and drug activity. Some people take some various forms of drugs, the combination of which they call colos. I don't know what they call it now. Okay. Now, what is the problem about alcohol and drug consumption is that when they indulge in drugs and alcohol, they can get themselves involved in risky sexual activity, either against their partner or against other couples outside or against commercial sex workers. And when they now get involved in those ones, the likelihood that they may have sexually transmitted disease, which they will now transmit to their wife or to their spouse. So basically, when you now notice any form of symptoms of any form of sexually transmitted disease, what you need to do is to try and see your doctor, who will now investigate and evaluate you, and now say, okay, this is what the patient has, and this I'm going to treat you accordingly. Now, investigating patient in this part of the world sometimes can be very difficult, especially the molecular tests that are not readily available. So most of the time, when the patient comes, we treat them using what we call the syndromic approach. So I want to take a breather here so that you can have, if you have any question to ask, so before I continue.
All right, thank you so much for the breakdown of how, the prevention.
Hello?
Yes, I can hear you. Can you hear me?
Hello?
All right, yes. I can hear you, Dr. Sazo. Can you hear me now?
Yes, I can hear you very well. Yes.
Okay. So
let me take a breather.
All right. Thank you very much, Dr. Sazo, for giving us a breakdown on prevention of or why it is actually important to prevent sexually transmitted disease, especially for a woman. Thank you so much for that. Now, this is Women Radio WFM 91.7, and this is the program Radio Doctor, where this is your free health consultation program where real doctors advise real people. Now, Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio right here. Radio Doctor comes to you Mondays through Fridays from 10 a.m. And today on Women's Health is supported by ACT Foundation. So do want to call in. 07000 917 917 is a number to call in. Let's get your thoughts. Let's get your concerns. Let's get your questions, all right, on prevention and treatment of sexually transmitted infections in women. All right, maybe you're concerned that, okay, this has affected my infertility in one way or the other. The doctor is here this morning to actually attend to your concerns and advise you appropriately on what to do. Okay, so do well to send a text to or a WhatsApp message to 070 317 56537. Send in a message or a text or a WhatsApp message 070 317 56537. We're here for you. The doctor is here for you to actually get your concerns, your questions, or your thoughts on our topic of discourse today. It's on women's health, so please feel free to call in. All right, and if Radio Doctor Women's Health has actually impacted you in any way at all and you want to let us know, please go ahead, call in, or rather send a message so that we will definitely have your testimony, because it's definitely good to know how this has impacted you so far, and I'm sure the doctor would also love to know. So do also send a text or a WhatsApp message to 070 317 56537. My name is Rose Yusuf Kaiser, and I have with me today Dr. Ede Edokolo Osazua, a consultant obstetrician and gynecologist at STIs Family Hospital, with us this morning on the program Radio Doctor. All right, Dr. Osazua has told us a lot this morning already on treatment and preventive, or rather why we should be prevented in the first place. All right, we're talking about sexually transmitted infections. All right, so Dr. Osazua, maybe in the course of all you said this morning, yes, you said a lot, and you said, okay, let me give you a chance to ask questions. So I'm sure that maybe some of these questions I'll be asking you, you must have spoken about it, but for the benefits of those who joined in and for the benefits of wanting this to sink in really well, we might just be going over some of the information you have given us already on sexually transmitted infections. So let's start with the most effective preventive measures against sexually transmitted infections. Now, you've talked about condoms, and you said it's not 100% either. You've also talked about the one we could use for oral sex and all of that. So what's the most effective preventive measure right now, against sexually transmitted infections?
Basically, the most effective ways of preventing sexually transmitted infection is abstinence. Let us start from there. So that is the most effective. Education of the child. Abstinence is one of the first, is the best way. 2, if you must not have sex with a partner, so then you must use what we call the protective methods, i.e. the use of condom or the oral gland for oral sex. But however, it is usually safer to be in a monogamous relationship in which both partners trust themselves and they play by the rules. If they are not playing by the rules, definitely there will be risk of sexually transmitted infection, which can either be trichomoniasis, chancroid, HIV and hepatitis. Now, however, condom can protect against HIV and hepatitis, but for those ones that have lesions like the herpes and the chancroid, now there's a tendency that skin to skin contact can end up having patient can get this sexually transmitted disease through skin to skin contact. So when we start dealing, maybe next when we are dealing with the different types of sexually transmitted disease, will become more clearer. Why? We know that there's actually no safe period. It's playing by the rule. Abstain, cannot abstain, be in a monogamous relationship. If you're not in monogamous, use condom. Now, for those that have vaccine, like the hepatitis B and the human papilloma virus, they should get vaccine for them. Let me also say that sometimes that rectal cancer and bleeding from the rectum have also been attributed to what we call sexually transmitted disease, especially the chancroid. At the end of the day, a young person will tell you that, I've seen them in the recent time, 35 years old, 30 years old, now having what we call colorectal cancer. Now, this may be due to either he has human papilloma virus, which has destroyed the rectum, and the patient end up having rectal cancer. So, safe sex is the key to prevention of sexually transmitted disease. And if you notice any symptom, unfortunately, these symptoms, most of them are asymptomatic. And when you notice any symptom, present on time, so the doctor can evaluate you and do some tests. And if you notice any symptom from your partner, and it's both partners that are involved, please, it's better to do what we call contact tracing. If the man has been involved in sexual sex activity with other partners before, you trace and treat. If not, you treat both couples at the same time, especially when there are evidence of extra marital affairs or somebody who get engaged in sexual intercourse with commercial sex workers, which are highly at risk of having this disease. So if somebody lives his life well, sexually transmitted disease will be far from person. If you live well, marry the right person or get yourself protected, sexually transmitted. But if you now begin to live anyhow and you want to live your life as it pleases you, then we also end up having this problem and becomes an issue later in life, not only to you, to your children, and to your spouse.
All right, thank you so much, Dr. Osazua, for that. This is Women Radio WFM 91.7. I'm still expecting your calls to come in because Dr. Osazua is here, and I think this is something that should concern you, should concern your families also, because at the end of the day, it's something that we all have to deal with, and it's something that when you know what to do, you definitely know what to do, okay, on this. All right, so thank you so much, Dr. Osazua, for that explanation. Now, I know you also touched about getting tested for STIs and all of that. So, and you mentioned that most of them are asymptomatic. Now, how often should we get tested for STIs, even if we are not experiencing any form of symptom? There's no pain anywhere. There's no, maybe the mucus coming from the vagina is not, it doesn't have any coloration, doesn't have any smell, but maybe there's an infection somewhere just hiding and just waiting for a time to manifest. So how often should we get tested for STIs?
Yes, for people who are high risk, people who indulge in commercial sex activities, or people who travels long journey and they break around hotels and everything, or those who knows they have exposed themselves to a high risk person, immediately after exposure, it's better to be tested to avoid complication. People that are not high risk, your spouse, it's you and your spouse, and two of you trust yourself, then there's usually no risk, except maybe you have symptoms.
Okay.
Yes.
All right. Thank you so much, Dr. Osazua, for that. Now, help us explain the importance of using barrier methods such as condoms in preventing STIs. How important is that, even knowing fully well that, condoms are not even 100% in the first place? And you have mentioned that abstinence is the best form of, preventive measure right now when it comes to STIs. So, but, if we can't abstain, then that means there must be something else we can use, which the condom is giving us that option. So, but how important is it to use condom in terms of preventing this, even as we know that it's not still 100%?
Condom is very, very important in preventing sexually transmitted disease. Very, very important. The only challenge with condom is that one, people are not committed in using it. Okay, so those readily available. Most of the time, it's not there when people are pushed to the west, especially the people that travel long journey. It's safe for preventing almost all form of STIs, the syphilis, apart from the syphilis, HIV, hepatitis. Condom can prevent against those ones. But however, for those ones that have ulcerations, because some people have chancroid, for instance, some people may have syphilis, for instance, some people may have herpes. Those condom cannot cover those genital areas that release those things. But definitely, when you notice all those ones, so it's better when you notice any swelling, any ulceration, it's better to avoid sex intimacy with that kind of person. But however, if you cannot, you still use condom, it will still protect you. But however, the risks of acquiring those diseases are there. So common sense, you use common sense when there are those ones that are ulcerative. Avoid sex during that period. But if they are there, you cannot avoid, use condoms, it will still protect you, but however, there's still risk of acquiring the disease. Otherwise, if the patient doesn't have any form of ulcerative forms, like the herpes, like the chancroid, like the lymphangioma venereum, so condom will be found to be very, very useful in prevention of sexually transmitted infections.
All right, thank you so much, Dr. Sozo. But are there other barrier methods apart from condoms that could be used?
I talk about the oral dam for people that are involved in oral sex. Okay, the oral dam that are involved in oral sex. Other barrier method, no. People are talking about some different bactericide that you can what's it called, that you can spray to the vagina to the prenatal delivery. But how effective they are, we don't really know. But we see emphasize that we use barrier method. Or after delivery, after sexual intercourse, you are being worried about that, you have acquired sexually transmitted, see your doctor and remove the issue of stigmatization and make it plain, especially for those who are engaged in casual sex, especially with commercial sex workers. So those ones, you have to come over for investigation and treatment immediately. But if it's HIV or hepatitis, not anybody can do. But if it's bacterial infection, then you can easily treat.
Okay. All right. Thank you so much, Dr. Sazua, for that. This is Women Radio WFM 91.7. The number to dial is 07000-917-917. If for any reason you can't get across to us through our phone lines, please do well to send a text or a WhatsApp message to 070-317-56537. All right. So let's look at how curable these STIs are. Now, earlier you mentioned that there's some that are not curable at all, and there's some that will just live with you, like the hepatitis you mentioned. Now, let's see how can individual manage and treat non-curable, although you said we're going to look at the infections one after the other as time comes in, but just for the benefit of today, kindly let us know what are some of the curable ones and some of the incurable ones, the non-curable infections, so that we actually know how careful we should be or what we are actually looking out for.
Okay. But the curable ones are the bacterial type. Okay, you have the syphilis, they're curable with antibiotics. Gonorrhea is curable. Trichomonas vaginalis, they are all bacteria, they are curable. Hemophilus degree, they are curable. Chancroid, they are curable. Now, the hepatitis B is not. But however, if you take your immunization, it's not curable, but if you take your immunization before you acquire the disease, it's fine. If you take your immunization, the chances of acquiring the disease is minimal. The herpes simplex, even if they are not, there are two types, the herpes simplex 1 and 2. So even if the virus can be in your body and can be in the latent phase, may not affect you, may not affect the patient. The HIV is not curable, but however, there are drugs that are available for treating it. And the human papilloma virus, HPV too, are not curable. So the viral type, the hepatitis B, which can cause liver cirrhosis and cause hepatocellular carcinoma, the herpes simplex, the HIV, the human papillomavirus, they are not curable. However, there are vaccines for human papillomavirus. There are vaccines for hepatitis B. HIV, they are still looking for vaccine today. However, there are drugs that suppresses it. So they are not, all those ones are not curable.
Okay, all right. Thank you so much, Dr. Sazua, for helping us, differentiate the ones that are curable and the non-curable, infections. All right. So, let's look at vaccinations. Now, what role or how does vaccination play a role in preventing certain STIs, and which of them are currently available as it is right now? Because, well, at the end of the day, we know that we'll look at them one after the other and we'll know which of them has a vaccine or not. But for the benefits of our program today, what role does vaccination play in preventing STIs? Is it possible that, you get vaccinated even before, like, you have the vaccinations that are being given to children, to stop any form of disease or stop any form of infections? Do we have such vaccinations for STIs? And which of them are currently available?
Okay, there are vaccinations for the hepatitis B and then the vaccination for the human papillomavirus. Okay, two viral hepatitis B and human papilloma vaccines are available. Now, the vaccine will prevent the hepatitis B usually given as a start dose. Then you need a booster dose, maybe about 4 weeks thereafter. Okay, so there's hepatitis B vaccination to prevent hepatitis. Don't forget that hepatitis can cause hepatocellular carcinoma, that's cancer of the liver, can also cause liver cirrhosis. So, hepatitis B vaccines are available. Okay, apart from that, the vaccine also prevents meningitis and also prevents some cross protection against gonorrhea. But most of the research is still on in the vaccine for chlamydia, gonorrhea, syphilis, and trichomoniasis. Those vaccines are not available. For chlamydia or trichomoniasis, those vaccines are not available. But for the human papillomavirus, there's also vaccine for it. So the human papillomavirus vaccine basically is available now, especially for girls that are within the reproductive age group. Even men are supposed to take it because they are at risk of also having perineal cancer from infection with human papillomavirus, as well as infection with human papillomavirus, as well as infection with rectal carcinoma. They can also have rectal carcinoma from human papillomavirus. So there is vaccine for them, and they are readily available. These several vaccines are available, which is for CA service type 16, for human papillomavirus for type 16 and 18, and the Gardasil vaccines are also available, which is for human papillomavirus 9, 8, 11, 16, and 18. So these vaccines are available, but other ones, research are still going on for the vaccine, especially for the chlamydia, syphilis, and trichomoniasis. So those are the only two that have vaccine: the hepatitis B vaccine and the human papillomavirus vaccine.
All right, thank you very much for giving us that information and telling us what vaccines are available at the moment. Okay, this is Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and of course, this is about 20 minutes to 10 to 11, I beg your pardon. And this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, this is Nigeria's first specialized health program where medical doctors consult for free and advise on radio, right here on Women Radio WFM 91.7. So today it's Women's Health, and of course it's supported by ACT Foundation. And we have Dr. Ede Odopolo Osazua, a consultant obstetrician and gynecologist at St. Ives Family Hospital, this morning consulting and advising on prevention and treatment of sexually transmitted infections in women. All right, so we'll just head on with the program. Do well to dial the number 07000 917 917. Send a text or a WhatsApp message 070 317 56537. All right, so we know which of the STIs have vaccinations available and which doesn't have right now. So let's talk about open communication. All right, so as a gynecologist, okay, how often do you have to tell your patients that you need to open up to your partner, you need to communicate very well, you need to open up to your sexual partners and say, okay, I think you're not the first person I've actually had sex with, or rather I have multiple partners, so before we can have anything done, I think we should go and have a test and all of that. So I'm just talking about open communication. So what role does being open play with sexual partners in preventing the spread of STIs? Do you think that could actually be a very big option that should be explored when talking about or when preventing the spread of STIs?
There's so much stigmatization associated with sexually transmitted disease. So there's nobody on the surface of Nigeria that will open up that, she just got an STI, or she has gone to sleep with someone that has an STI, and that they likely for him to have an STI. So it's very rare from both couples, from both partners, either male or female. So what we normally counsel patients when they do come around is that, avoid, those on that kind of people, avoid risky sexual behavior. Avoid, if you are going to be involved in sex, ensure that it's a monogamous relationship. If you do have, rather than go for treatment before you have a sexual intimacy with a patient that you are in a monogamous relationship with, but hardly would anybody tell you that he has had sex with so. Otherwise, you break the relationship and break the family. At the end of the day, they will not tell you that, the devil has struck. So sometimes it's wisdom that used to manage all these things. No man, or very difficult, or woman will tell his spouse that he has gone to have extramarital or extra relationship sexual activity. So most of the time we'll ensure when they come around, they tell us, we just treat them. But you can present to your doctor and say, you have done that, please don't tell my wife. They will treat you and will cancel it. I'll stay for sexual intercourse within this period until you are fully treated and you have recovered, so that you cannot transmit the disease to either your wife or to your husband, or to your boyfriend, or to your girlfriend. Otherwise, the body you are giving that family become too difficult to bear. You cannot imagine somebody having hepatitis or somebody having gonorrhea or syphilis and then give it to another partner, which I think is very unfair. At the end of the day, if another person goes back to marry another person and you now have issues of infertility, issue of human papillomavirus, cancers of the cervix and co, that would be too unfair. But nobody normally cares about anybody anyway. Everybody does anything they like. But we encourage people to do the right thing. If you are involved in extramarital sex, and especially with high risk people like the commercial sex workers, the drug addicts, those who are so involved in tattooing. Sometimes you cut your body and you get one form of infection or the other, because sometimes all these instruments are not also sterilized. Even in some hospitals too, can also get infected. Better to seek your doctor's advice so that he can counsel you and treat you accordingly, so that you can reduce the burden of sexually transmitted infection in Nigeria.
All right, thank you so much. I can just imagine the issue of stigma. You coming up and say, I've had like 3 or 4 sex partners already, and the opposite sex or the opposite partner is looking at you like, so and all of that. So, well, thank you very much for that. I can just imagine what you all go through as doctors every day, as regards this. But thank you for always being there, and thank you for helping us all out. All right, so you can dial the number 07000 917 917, send a text or a WhatsApp message to 070 317 56537. Let's get your thoughts, let's get your concerns, let's get your questions on prevention and the treatment of STIs, sexually transmitted infections in women, this morning on Radio Doctor. All right. Is it possible, Dr. Sazua, that one could just do, let's say, a home test for STIs? How possible is that? Is that option available, that you don't have to go to the doctor or you don't have to go to the hospital to go and have yourself checked?
It's not really available. It's not available.
Okay.
Even each of them is not available. Because most of the time, it's usually asymptomatic. Okay. You need to see it and do some basic ones. Even we don't also do all of them, because the facilities are not available. But however, That's why we normally treat them based on symptoms. Okay, but however, that also has some of its own disadvantages when we're talking about syndromic management of STI. Okay, sometimes when we talk about syndromic management of STI, let me quickly just highlight that one as we continue. We're talking about the treatment of all the symptoms of STI. And what are the common symptoms that we look at? We look at vaginal or discharge from the urethra. But people may have genital ulcers. So what we normally do is that when we notice any of these symptoms, we just give them all the antibiotics for all permitted to use this, for all the if I'm permitted to use this, all the STIs that are available. So we give them drugs, all of them. So when we do that, sometimes we find that it's very cheap, and sometimes we don't really wait for the symptoms, all the symptoms to appear first before we now finally treat. We have so that this will also ensure that we avoid prolonged treatment. Sometimes we normally have an issue that when we treat this patient, we over-treat them, but we don't really care because we need to prevent STI because most of the symptoms are all asymptomatic. And WHO, which is World Health Organization, recommend screening strategies for those of higher risk of infection, such as sex workers. For those that are higher risk, so we need to screen those ones. For those that are higher risk, like sex workers, men who have sex with men, the gay men, we ensure that they are screened. Adolescents in some settings are also screened, and sometimes our pregnant women too are also screened. And also to interrupt the transmission and prevention with sometimes reinfection, sometimes we also make sure that people with HIV patients are also screened, and whereas their partners. So how these partners are screened, gay men are also screened, commercial sex workers are screened, adolescents in some settings, and also pregnant women too are also screened. But however, we normally manage this patient syndromatically. We give them all the drugs that they need.
Right, thank you so much for giving us all these categories of people that needs to be screened and need to watch out for STIs. Thank you so much, Dr. Osazua, for that. All right, now, so when we started, you mentioned education, you mentioned awareness, in terms of preventing the spread of STI. So I need you to dwell on that a little. How far can this go, the education and awareness, how far can it go in preventing the spread of STIs? You've mentioned it before, but I want us to give it some minutes and dwell on this, on the importance of this.
Okay, so before I enter that, education is very key. So when you educate a child or the public in any form of medium, like what we're doing now, via radio, Instagram, broadcasting in the public, in the church. So we educate them about the likely complications of sexually transmitted disease and the need for them to abstain and the need for them to use barrier methods. So education is very key. So counseling, controlling the spread will involve you give the good information, education, counseling, and public announcement also will reduce the risk of sexually transmitted disease. But however, the problem we normally have is that lack of information. We don't have good education. Counselors that are there are not even good at all. They just counsel them. Some of them are very, very vindictive. So that to bring them closer that they have sexually transmitted disease, they keep on provoking them and begin to say they are committed sin, which they are not.
I'll need you to hold your thoughts for a minute. Let's pick up this call. Hello, good morning. Hello, good morning. You're connected. All right, couldn't hear anything from this caller. Do want to call us back, 07000 917 917. We just have a few more minutes to be here with the doctor. So do want to call in, or better still, you can send in a text or a WhatsApp message to 070 317 56537. All right, go on, Dr. Osazua.
Okay, so I was talking about the problem that we normally face. Okay, so sometimes lack of public awareness, lack of training among health workers. Some of them are not even good enough.
Yeah.
Sometimes some patients also come and long-standing and widespread stigma around STI. Some of us, some health workers are so very even now when he has STI, don't get closer. So most of these patients we want to come up and own up. So stigmatization is a major problem that we also face. And sometimes some patients who have problem with the barrier method, they don't tend to use it effectively well. effective use of these methods are not available. Health services for screening and treatment of STI is also not available. And limited resources, because most of the resources are being cornered into infrastructure, are being cornered into different things. So it hurts. That's one of the lowest budgets. So lack of limited resources are not available. I said about stigmatization is also an issue. Poor quality of service is also an issue that we normally face. Sometimes most of these patients have to pay because from their pocket, and most of these people doesn't have money. So out-of-pocket expenses are usually an issue. So population with the highest rate of STIs, such as sex workers, men who have sex with men, people who insert drugs. So we also have an environment where you have gay sex, where sex is part of what they do for a living. So you're not going to tell the person to leave her job. So it becomes an issue that we normally face soon. And some people too also live in the prison too. There's also issues with people who live in prison, and they begin to have the institution of usually lesbianism and gay sex among them. Then inmates and mobile populations, then you have a lot of inmates, we talk about mobile and adolescents in high burden countries for HIV often do not have access to adequate not one, two, friendly health facilities. Some of our health workers are very aggressive in public spaces. Some of our nurses are very aggressive, and the way they talk to this patient, they may not want to come back again. In some countries, STI services are often neglected and underfunded. In good countries are like ours, especially in African countries, difficulties in providing testing for asymptomatic patients and insufficient number of trained staff personnel, limited laboratory capacity, and inadequate supply of appropriate medicine. So those are some of the challenges we face. Now, what the WHO now responds to is they develop global targets, norms, and standards for STI preventions and testing and treatment. They also support the estimation and economic body of STI, that's what WHO is doing, and the stigmatizing of STI surveillance. So also, they also globally monitor some STI like gonorrhea, and some of them have also tried to set up a global research center for sexually transmitted disease. So we encourage our government to also do that. Set up a global research center for STI, ensure that there is surveillance for people who are exposed to STI, minimize the stigmatization that is associated with STI, provide a welcoming and a friendly environment for people to come in and express themselves, not by being vindictive as we see, or stigmatized as we see in this part of the world. This will help us to reduce the burden of sexually transmitted disease as well as its associated sequelae, i.e. complication.
All right. Thank you so much, Dr. Sazua, for giving us how education and awareness could actually go far in preventing the spread of STI. So this is where we'll draw the curtains for today, Dr. Sazua. So is there anything that maybe we have not mentioned that you feel is actually key in treatment and prevention of STIs that we really need to know before we go? And you give us your final words on that too.
Okay, thank you very much. This is a series of topics that we are dealing with this month. We'll continue next week, by the special grace of God, talking about a different type of STI. But I want to say the sure way of preventing STI is education. Educate your children, educate them in your church, to educate them on the need to avoid risky sexual behavior. And I will encourage the husbands and also the couple and the wife too. Please, any woman, any wife that God give you, stay put there. Don't become a problem to other people. Don't move around. Don't patronize commercial sex. I know it's their job. The commercial sex should look for work to do, so that you should not go home and bring sexually transmitted disease and transfer it to your wife and become a problem. So I encourage monogamous relationship. I encourage, if you will have casual sex, use protective method. And lastly, we must ensure that we educate the public about the burden as well as the complication of sexually transmitted disease, as well as the economic impact on the welfare and the productivity of an individual, as well as the country and the nation as a whole.
All right, thank you so much, Dr. Sazua. Thank you for being a part of Radio Doctor today. We really do appreciate having you on the program, taking our time to be here.
Thank you very much.
All right, do have a great day and enjoy the rest of the week too.
Thank you. See you next week.
All right, so that's coming from Dr. Ede Dopolo Osazua, and of course, he is a consultant gynecologist, a consultant obstetrician and gynecologist at St. Ives Family Hospital, and he has spoken to us today on prevention and treatment of sexually transmitted infections in women. All right, so this is where we'll draw the curtains for today. Today's Women Health on Radio Doctor is supported by ACT Foundation. Tomorrow is another day on Radio Doctor, and of course, we'll be dealing with general health tomorrow, and on Thursday, we'll be looking at another specialty of Radio Doctor. So do want to stay with us right here. Thank you so much for being there. Thank you for listening to the program Radio Doctor. My name is Rose Yusuf Kaiser. Do stay tuned to Women Radio WFM 91.7. Good morning.
WFM 91.7.